So building off the last two comments, I was curious, and we don't have to go around now, sort of like open forum, but could each of you talk a little bit about those people who are in your congregation or who come to worship, and what that population looks like, and where is the need for healing, whether it could be mind, body, or obviously sort of spirit. Curious, we talked about caregivers. Aging came up a little bit as well, obviously tied into that. But I'm curious to know, like, what are some of the things that you're seeing sort of rise up, and they could be issues that have always persisted, or they could be new things that are taking on added importance. But if you could share a little bit about some of the people who you work with and their needs, it would be sort of a helpful sort of level setting for us.
Something that encapsulates the things that you were saying is we have the founders of the church who are getting old. And in those days, they had people, especially the ladies, that would be able to be at home, to take care of others and to reach out to them. But now, that everybody works, and sometimes two jobs. So there's no longer that demographic of people to reach out and be around all the time during the day and help people. So that base of people reaching out to the ones that are getting older and can't make it to church anymore is disappearing. I see that as real difficult.
Yes.
One of the things that I'm seeing in my congregation is a lot of people of retirement age who, for one reason or another, are having trouble making ends meet at the end of the month. And it's a very quiet population because I think there's just a lot of shame around that and having to ask for help. And I see more and more of that. These are people who, to look at them, you wouldn't know that they're struggling like that, but they finally get up the courage to say, maybe there's some assistance you can give me just to buy some groceries so I can get through this last week of the month. And seeing more of that in that population. I mean, I'm speaking specifically of 60, 70-year-old. A lot of them are single, and many of them are female. That just need that extra assistance.
So a quick follow-up to that. I mean, if I were being nostalgic, and maybe this is not a fair representation, but the idea of smaller towns where there was sort of, everything was integrated by class, at least, and whether that was a school or a church or what have you, so that when you had those kinds of situations, there was always this sort of potential for give and take and people helping each other. To what extent to which are your congregation integrated in that way, or is it sort of a largely sort of monolithic sort of group by class?
Can I speak?
Sure.
To a point? Being the minority in Santa Barbara is devastating. I came in under adverse conditions and to start rebuilding a healthy, well-balanced church. The community and even most of the jobs and other things in this community has been very hard to acquire. We service the homeless and others in some capacity or others, but the majority of those who have been here for some years don't have a healthy mindset about Santa Barbara. They're here because there's no place else to go. There's a lot of racism that they deal with, not only from community, even to the hospital to a point. They have no fondness of going to the hospital. And so the only healthy thing is the church. We're just one of predominantly 5, but we have a mixed membership. And I prefer that because people are people. But if you look at the climate of Santa Barbara. They're here because mostly they started here, and I have some who's been here 40, 50 years, and they just don't want to go anywhere. But so they are closed unless you get to know them intimately. You may not know their struggles. It's just, Father Brian and I have joint relationship, and we have traveled, and we hear some things we don't even want to repeat. But the whole point is that we ought to be good. We ought to be proud that we're here. And I don't know how it makes anyone else feel, but and so the community or even the parishioners feel like we're almost less than second-class citizens. And had it not been that we needed to go outside of, because we didn't base our relationship on race, but to make sure everyone who comes that they feel that our community care, our church cares, and be supportive of what we can do for them. And so medically, they only go to the cottage if they have to. And so I just want to make it kind of brief, but that's the atmosphere that we have to deal with on a continuous basis.
All right, thank you. Yes, sir.
Well, I was going to respond to the question you had to, for our congregation specifically, and for many of our congregations, we're finding what Mark was just talking about. We're getting more requests for oblation types of needs or support needs towards the end of the month. And a lot of it has to do with intergenerational families, that grandparents are taking care of grandkids so that this one can work because the income for the different things. And that's the reality. And a lot of people love Santa Barbara, are intent on living here and staying here, but they are aging out with their income, even well-planned packages. We're outliving a lot of the best plans financially that people have had, and this is an expensive community to stay in. So I don't think that we have the dedicated women that are home taken care of, or the younger. Everybody's working, everybody's trying to take care of multiple generations of needs in their family. One of the things that I find is a great need is transportation. When people stop driving as they're aging, and then because they have great pride in not asking for a lot of help from others, they're not asking for a ride to get to the doctor until now they're showing up in the emergency room because they've got a real problem. So transportation just does not seem to be well orchestrated. You got to call this place 2.5 hours in advance. You've got to wait 2.5 hours to get picked up.
And free transportation.
And free transportation is, that's where you probably look to your family and your faith congregations for somebody that can help you. But transportation is becoming a real focus area.
I'd like to.
Yeah, please.
So our congregation is primarily older, but we've been growing in a lot of different capacities and are essentially feel overwhelmed with the amount of issues that kind of keep revealing themselves. And one of those reasons is I work a lot with the LGBT community, specifically the trans community, as well as college students. And there are absolutely no resources for the trans community in Santa Barbara County, period, end point. That I have, families to adults having to travel to San Luis Obispo because there's one doctor in San Luis Obispo just to get hormones and any sort of like medical support. And now there is a clinic that is in out near Ventura, but even then, these are people who have difficulty finding employment, housing, who are going by bus, and I have a lot of opinions on this, but I think all of the resources we have in this town and the large LGBT community that is here, I think it's absolutely deplorable that we have no resources for someone to get hormones, just basic hormones. And so there's a lot of issues surrounding that. And then the mental health. I think mental health in general is something we like really have to talk about in this town, but mental health also for those who need long-term care. You know, I'm frequently meeting with people who are seeking help, who are taking the necessary steps to be as healthy as they can be, and are being, you know, checking themselves into Cottage for the, you know, 72-hour suicide watch, and then being moved to, you know, Pasadena because there's like not enough beds, and then that person is discharged from Pasadena and has to find their way back to Santa Barbara and not given long-term care. And I think there is a huge issue with not having resources for people who have constant or chronic mental wellness issues. And that isn't just like a day center, but really needing to address that, especially because we're a middle point between LA and San Francisco for the homeless and vagrants. So we're constantly going to get a lot of people in our community who, regardless of whether they live here or not, who have extreme mental health problems. And the other thing with students, you know, we're talking about this, you know, intergenerational care or connectivity and the lack of middle class. Well, it's really the lack of anyone who is like 23 to 40, I would say, in this town. That it's not just those kind of what your typical idea of a homeless person is, but a lot of our students are homeless, and a lot of our students are sleeping in their cars because there's no housing, and if there is housing, it's absolutely ridiculous, the rent. And so they're then living in facilities that, you know, one of our students in our church, he's paying like $500 more so he can have a burner stove and a mini fridge because all the other studio apartments that were cheaper didn't have that. So that students, yes, they have connectivity to their kind of, you know, UCSB has its health center and health network, and Westmont has its health center and network, but once they graduate, there's nothing there for them really. And then once, if they're looking for any sort of off-campus housing, which there's not enough housing anyways, in both of those universities, it's almost impossible to find something that they can then have a healthy day-to-day life, which obviously affects schoolwork and everything like that. So.
Thank you. Are there any other sort of issues that are arising, you know, in your own work, or different populations that we haven't sort of discussed? We've heard in previous groups discussions, a lot of discussion around the homeless population, and also of you know, Latino or immigrants or undocumented having specific sort of needs. Are there anything else that you are seeing in your work that we should sort of put out on the table before moving to the next set of questions?
Well, I just want to underline, this is a point about mental health care, and that there isn't any mental health care. Like, well, Cottage used, or St. Francis used to have a mental health care for senior citizens, and there is not one here, and I think that's a big hole in what Santa Barbara provides as far as healthcare goes for the senior population, specifically mental health care, specifically detox from prescription medication, for instance, and I think it's been farmed out to communities south of here, and it's a struggle for a lot of my population, specifically in my congregation.
Can I add just, we were trying to do a series on mental health for senior citizens, and we could not find anyone to talk to come in who would talk specifically about the needs of those who are in the senior population. And we have members in our church who are connected to the mental wellness centers in town, so it wasn't like we weren't connected. So I think this idea of not just mental wellness and mental health, but mental health even specifically for seniors, when we live in a town that is like the land of retirement and senior living facilities, to not have something addressing those needs is important.
So it's interesting in that when we conversely had some internal discussions, we did groups like this with members of cottage staff and people, similarly raised issues around sort of mental health and access to sort of services and things like that, and a willingness to go out to the community. So one of the things that's sort of come up is sort of trying to understand sort of the barriers to sort of creating sort of a healthier community and healthier populations and healthier individuals, or trying to understand sort of what are those barriers. Is it that we're siloed, that we're not making connections, we don't have resources in some situations? Is it something cultural between sort of like just the structure of a community that does have disparities? I'm curious, in your experience, what you see are things that are endemic to Santa Barbara that make it more difficult to get people the help that they need. Because we certainly have had a lot of conversations with really well-meaning and well-intentioned people, whether it be from government or health or community organizations. And I've asked this question different ways, multiple ways. I'm always, as an outsider coming into Santa Barbara, you're always surprised because you sort of come into it with a sense of like, oh, this is a very affluent community. And then you learn more that there are more nonprofits per capita in this town than any place in the country. And yet we do have still these persistent sort of issues and challenges. Yes, thank you.
I think there's a significant cultural factor that relates to the health of the communities here. And I think the politicians in Santa Barbara like to talk about our wonderful pluralistic community in Santa Barbara. The truth is that a lot of these communities have nothing to do with each other. They may live, close to each other in proximity, but they don't share a great deal culturally. I've seen this at gatherings. My wife is director of resident services in one of the retirement communities here, and you have a gathering and you have management over in one corner, and you have the caregivers and the environmental services all over in the other corner speaking Spanish, and English is on the other side. So the reality is they're in the same room, but they really almost have nothing to do with each other. And I think that I think there has to be a much more concerted effort to build bridges between the various communities. It's not just going to happen automatically. I think that Pastor Lewis and I were part of a racial reconciliation group for 8 years involving white and black men. And as whites would listen to the experience of blacks in Santa Barbara, it was like, this is not a Santa Barbara we recognize. It's like a parallel universe. And I think sometimes those of us in the majority community are not able to really comprehend the experience of somebody in the minority community like that. You see the same reality out in Bolita, where the freeway divides the Calle Real side from the Hollister Avenue, and you look at who's walking in those places, and they're totally different populations that have almost nothing to do with each other. And I think feeling isolated, we can talk in theory about social justice, but when communities feel isolated from each other, I think this diminishes the quality of life in a community. So I think, I'm not sure how this relates to the hospital, but I think it relates to people's sense of well-being in the community, particularly for different minority groups.
Yeah, it was interesting. Even we saw some of that even in the groups internally at Cottage Health, where you would talk to the doctors and you would talk to environmental, services, and it was similarly night and day in terms of some of the needs and things that came up. What other thoughts do you have, whether it's sort of cultural issues or resource issues, that keeps a community or county that, at least on face value, should, you would think wouldn't be dealing with the same kinds of problems that other communities that maybe have a different set of resources available to them or a different kind of set of assets facing?
I think to echo what you're saying is Santa Barbara is extremely ghettoized, but doesn't want to acknowledge it. The fact that, there's like the east side, the west side, the mesa, where you're talking about the highway dividing Goleta, that there's these, racial communities, class communities, and then minority groups within that don't rarely kind of cross paths. And what I've discovered sort of in the time that I've lived here too is Santa Barbara has this idea, this ethos about itself that, it's this wonderful place that everybody wants to come to and it's so beautiful, which, those are all true, but that then prevents it from acknowledging the fact that like there are real problems. And I think that sometimes the overarching culture can be to maintain sort of the postcard of Santa Barbara. And how I've seen that come out is the lack of support for the homeless population, especially. It seems, from what I've heard from parishioners, that like every 5 to 10 years there's a bill that comes up in the city to make some way to like make it illegal for you to be on the streets or panhandle or be a visibly homeless or so I think that there is a deep kind of culture of we just want to be the pretty postcard. So if we're going to be the pretty postcard, then the best way to maintain that is to just kind of sweep the things that aren't pretty under the rug and ignore them in whatever way we can, rather than like crossing those lines and crossing those barriers and building bridges between different communities. I feel like it's more about, can we, put up a sheet so that you don't see that the lower you go on State Street, the more kind of hard knocks people you're going to find. That it's not so much of a postcard.
What other things do you see getting in the way of progress? I mean, clearly, housing has come up, transportation has come up. So I guess what you'd be raising is a question of political will,
I don't know how robust the system is at Cottage for a bioethics program, but when Jay made the comment about the amount of amazing things we can do now medically, the question for me many times is, we may be able to do it, but should we be doing it? And how much conversation goes on between healthcare people and clergy about bioethics of end-of-life issues, conversations with families, planning ahead. There's a lot of junk that comes up at the end of life many times with people that are estranged from each other. And so I'm a very strong advocate of very robust bioethics programs within healthcare environments. But I don't know what the relationship is with community seats and clergy.
Yes.
One of the things, and this I think relates to Cottage itself, I think it would be worth the effort of Cottage to begin to bring groups of clergy and doctors together to get to know each other, so that they don't tend to see what each other does as not being that important. That's not universally true, but I've encountered that. The same thing would also be true with some of the nursing staff, and I think, I can't speak for everybody here, but I've had experiences where nurses have come in and rudely interrupted a visit because they assumed whatever they were doing was more important than what a pastor might be doing at a particular time. And I think that I think if there were some meetings like this where you could build a relationship and have a better understanding of how each other sees their role in the healing process, it might improve that kind of thing. We're all on the same team and we all want the same thing for the person. And I've encountered some marvelous people at Cottage and some people that were, quite frankly, very insensitive.
How would you generally characterize the, I don't know if respect is the right word, but the acknowledgement of sort of, the role of spirituality or mindfulness or those kinds of things in the actual physical healing? Is that something that you think that, I don't know if you've got comparative experiences, but something that is acknowledged and respected in this community more than others, or not as well as it certainly could?
That's a complicated question. I'll answer it just because I hadn't finished, but I'll respond to it. That you know, I think some medical personnel see spiritual involvement as helpful in kind of supporting the person, but maybe wouldn't embrace the thing that healing is a holistic thing, and that healing involves not just surgery and medicine and what have you, but prayer and, you know, as well. And I have seen people healed in ways that defied medical explanation, you know, that had to do with faith and prayer. But I also know that, you know, it's usually a combination of all those things. And so I think this has to be better understood in terms of the sensitivities of people in the faith community, that their sense that faith and prayer is just as, you know, a significant part of the process as, you know, going into surgery or anything else.
In direct answer to your question, I've only been here 1 year, but I've had no problem as far as respect and acknowledging that spiritual care is important and people coming in. And I haven't experienced what you have here, although I have in LA and Orange County, of people saying, "What are you doing? Get out of here. We gotta go. We gotta do things, right?" But here it's very much, "Oh, you all are busy. I'll come back later."
Yeah.
So I've seen on the whole a good respect for that, which is helpful.
Yeah.
I also inject, again, being 12 years, becoming involved in the community. I work with CASA in the homeless community, part of the interfaith ministries and all. And the problem is that the attitude is based on not so much holistic medicine. They look at the face and it's determined you have nothing to offer, which is sometimes sad, because in one sense of speaking, we all have some spiritual care that we can give, whether it's the person's in the hospital or even in the church building. The idea, of course, again, if you're a minority community, automatically feel like you're on welfare, whether you are or not. The objective is, their perception is, because they look at your color rather than what you have to offer, is that you're out of place. And that's why I was saying previously that it's very difficult in this community, especially if you didn't live or wasn't born and raised here. A lot of blacks end up getting picked up or stopped simply because they're black. And it's not necessarily they all done anything. It just automatically becomes suspicious. And even give you a record where you can't even get a job. And then they want to know why you act the way you do is because the way we've been treated. Not everyone here is, some have college educations and still can't get a job. And then you look at the fact is that we want to do this, but there's an exception to the rule. And usually because we are the exception, and the major problem was that they started moving blacks out of the community, and some had to go to Lompoc, Santa Maria, and other places because they couldn't afford to live here. It wasn't because they didn't want to be here, it's just the fact is that they had no other choice. And so probability, I know from someone saying to me that we want to make sure how many blacks are here, where they came from, and etc. So we automatically become suspicious. And how do you think that, like I said before, I mean, if I wasn't a pastor here, I would leave automatically. There would be no place here because I was raised in Ohio and other places. And to be almost like you back on the plantation, which is, and I've been to 3 colleges. I could, if I wanted to put up my doctor's, I don't need a title. I'm just a person of faith. And so we can sit in this to make the supposition how good it looks, but there's another side that doesn't favorably. We almost not even treated, well, almost equal with the homeless population.
So, this question of invisibility has come up a couple times. That the postcard analogy you used a minute ago. Like how? So, do you think it is a community in denial of many of its issues? Yes.
I mean, if you were told because you're black, you should feel proud that you're in Santa Barbara. Like, I've been to better places than Santa Barbara. I mean, I'm supposed to feel good because I'm in Santa Barbara. I mean, and I'm a black man, you tell me I should feel privileged because I'm in Santa Barbara.
There is definitely outright prejudice, I would say, as Louis is talking about race, but as I said before, I work a lot with the transgender community, and there are doctors who could give hormones, who are endocrinologists, but have outright refused to, because for whatever reason they say they don't know how, which I'm like, how can you be an endocrinologist who your whole job is to work with hormones and you don't know how to give hormones? And so the trans population, which a year ago was told there's nobody here, there's no one who's trans, is exploding. And of course it's exploding too because of, there's more stuff in social media, it's becoming something that's more noticeable in just everyday life. And because it's more noticeable, people feel safer. So because they feel safer, they feel that they can, live their lives more fully in the public eye. But as they become more public, the public doesn't necessarily accept or welcome or are willing to help with what needs they have. And I will say that I know Cottage has been trained in, their doctors and nurses have been trained by the Santa Barbara trans groups leaders on how to work with people who are gender nonconforming and using the right pronouns and stuff. And so I think that's wonderful, and I want to say good job. But also to be able to sort of assess the medical needs, and that the fact that there are these sort of prejudicial things happening, and not just for trans, but I think LGBT in general, of going to the doctor and having the sensitivity for the doctor to understand that when I walk in and I don't have necessarily a husband, and that that medical care might need to be more sensitive or adjusted differently depending on what one's sexual identity or orientation is.
Yeah. So, yeah, please.
I was going to say, so it sounds like part of the work of that end of the table, as far as offering programs, you talked about programs that you have building bridges between communities, building communities together. It sounds like one of the results of the data collection would be to get people to even understand the demographics and know that there are different communities here. And you talk about the postcard and hidden people and hidden communities that maybe a greater Santa Barbara community only thinks that it's just State Street, and they don't know about the communities who they might not know how big the black population is here and the troubles that they're going through. So it sounds like you need an information campaign first, so that people know that there are different communities to reach out to and to build bridges between.
I think Santa Barbara's just a tough place. I think the prejudice and the lines they draw go way beyond ethnic background. I noticed that when the first year I was here, it's pretty. I noticed that the first year I was here, it's pretty exclusive in a lot of ways, and it's very tight. They're narrow groups that don't communicate or really talk to each other, and it's all done kind of with a smile, and we don't talk about that. This is a tough town. I would not live here if I wasn't working here. It's very uncomfortable. But that's a whole nother story.
Yeah.
I think when it looks to medical care, at least my sense is the people in Santa Barbara that have means, they may not want to actually mix with some of these things, but they would like to put their money towards it. And money usually is the power base for change and when things happen. I think, I don't know, I didn't get involved with that in here, but in San Diego, I came up with some great solutions for homeless and the powers that be on committees that divide the money, they didn't care. They hadn't done it that way, so they just keep doing it the way they used to do. And because we're so smart as a culture now, we have solutions for just about every problem, whether it's school, prisons, it's just whether you want to change and implement is a lot of the big problems. And I will say for Cottage, I have had nothing but really good responses from the nurses there. And they are usually very respectable once I identify who I am. And the doctors, not so much. Doctors just don't really, they're just like on a mission. It's like, yeah, whatever, you can finish praying later. And of course, that's a very general statement. There, I happen to have some of your doctors in my church, and they're wonderful people.
Some of my best friends are doctors.
Yeah. So, but yeah, there is a difference. In fact, I'm always impressed at how many times when you're praying, a lot of the nurses will just join with you. And they'll say, yeah, I don't think you can get it.
Yeah.
So it seems to me that the harder the caring group and the challenge for them to do their job, the more spiritually they tend to be. And so, I kind of see a scale, and the more you're not really down hands on dirty, the more you can be what you want to be.
I want to sort of pivot a little bit and sort of take the idea that we're sort of talking about sort of people who are maybe feeling marginalized or invisible. And, obviously, when they come to you, they come to a place that feels very safe, right? And they feel very trusted. And this question of safety and trust has come up in other places. Sometimes they will feel very safe inside, say, the confines of like a Girls Inc. But some will feel less so. The example I've used previously is that a family will bring their daughter to a program like Girls Inc. And what we would take for for granted, signing a release form, that if something happened to my child under your care, that you should call 911 and get that child taken care of. And these parents are given pause to sign that because while they trust Girls Inc., they don't trust what happens when they get into a hospital and what happens in terms of may impact their legal status or things along those lines. So seems to be sort of this fine line or these pockets of safety and trust, but not a contiguous sort of sense of being sort of connected. And the problem, as the example I just said before, is that when that trust doesn't exist, then you don't access the things that are available in the first place, or you can't advocate for the things that you need. And I'm wondering if you could give a sense of how safe, and I don't mean sort of just physical safety, although that is an issue, but how sort of safe and secure and trusted people feel, in Santa Barbara and with its various institutions.
One thing that hasn't been brought up is in terms of kind of preventative care or care before you get to the hospital, there is very few options for if you even have insurance, as well as for the uninsured. And when there is an option, you call to make an appointment and it's like, in 6 months, we can get you in. So I think having faith and trust in the medical system altogether, it feels almost like non-existent, where sort of Cottage is what you're relying on because you can't get a primary doctor that you're going to be able to see for, a significant amount of time, or the clinics are so overloaded with patients, unless you have the means to pay for your concierge doctor, you kind of are out of luck unless you sort of are like, I'm dying and I need to see someone now. And what I find is it's pretty much Samson and that's it. And Sampson is completely overloaded with every single person in Santa Barbara area, and or it's you see a privatized doctor or you go to a clinic. And when I first got here, I had to go to a clinic because I couldn't get into Sampson. And I, who have resources, who have insurance, when I felt going to the clinic that I was taking someone's spot who would needed to be there more than I did. And that feeling of that the medical, just in general, there's not enough for everyone, just the basic. There's not enough. And what there is you're waiting months and months to, get an appointment just for basic needs. And so if you know that you're going to call and they're going to tell you we're not going to be able to see you, 4 months from now, then you don't make the phone call.
It's a little different subject, but one thing I noticed, anxiety amongst some of the baby boomers who are now hitting retirement age, is I think there's a growing level of anxiety about what does it look like to plan for retirement, because you don't know how long you're going to live, and if you live to be 95, I mean that could be 30 years for planning. Secondly, you don't know what your health is going to be like. You may be a healthy person till the day you drop dead, or you may be going from one doctor's appointment to another for the last 15 years of your life. And so there's a certain element of anxiety now because people are living longer, that how do I even know how to plan responsibly in terms of things like long-term care insurance, whether I should have it or not have it, and the kind of coverage that I'm going to need with to supplement Medicare A and B. And these are anxieties amongst the people that now are just kind of hitting the retirement age.
Yes.
So, it occurs to me that building trust is a long-time, lifetime kind of endeavor. And I think it's, it would behoove Cottage to be less monolithic. And I don't, I'm at the risk of being naive, I don't know how much Cottage partners with other nonprofits that are already on the ground in Santa Barbara, but providing that primary health care and partnering with organizations that are already doing that, Doctors Without Walls, Showers of Blessing that are giving showers to the homeless population. That is primary health care, cleanliness. And so Cottage, I don't know if Cottage has, it can be more visible in their support of these organizations that already are trusted. So partnering with trusted organizations builds trust. And also maybe some sort of a grant possibilities for these nonprofits in town that Cottage can provide. Again, putting their name out there as providers of these funds, partnering with local nonprofits that are already providing trustworthy health care.
Yeah, what I would say is that stuff does happen, and there are grants that go out to the community, and relationships with organizations like Doctors Without Walls. But you could certainly make the argument that it's maybe not as public or as well known as it could be. And I think part of this process is also sort of reevaluating and thinking about those kinds of questions. I want to flip it a little bit and just ask you from your perspectives, where does health, in a traditional sense, fit into what you try to provide for your parishioners, your congregants? Sometimes it's obvious. You pray for someone who's sick, and there's a prayer list and things like that. Sometimes it may go to helping them navigate specific services. I know in other communities that we've worked before, they've looked at some basic things like, what are we doing when we have potlucks? Are we trying to make sure it's healthier food that we're offering? Or one church even went as far as to actually put a scale on the when you walk in, so you have a weighing program so people would be more aware.
You're getting into real dangerous
Yeah.
territory now.
So I'm not
Very anti-body.
Yeah, I'm not advocating for any of those solutions. It was more a question of, and maybe that last example is a good one. Is where do you see your role and responsibility in those kinds of things, and what have you done to that end, or what have you thought about doing and said, no, that's a bridge too far? I'm just curious to know, like, you do have this incredible opportunity because you're a trusted voice, yet it's not something that you think of as sort of like maybe core to the expertise or your calling. So I'm curious to know how you see that fitting in and the kinds of things you're doing or have contemplated doing.
Say a scale of potlucks is probably a bridge too far.
The third rail, right?
My congregation is, I don't know, this might be a little, we're talking end of life here, so I don't know if this applies, but we partnered with an organization called the Alliance for Living and Dying Well, and their 5 Wishes program, and I think that goes a long way towards peace of mind, which, that's a big part of healthy living.
We do 5 wishes as well, and one thing that one of my congregants kind of said to me was, can I keep my 5 wishes with you? And so I don't know how much Cottage has say in that, but connecting 5 wishes to the congregations as well, so we all have that information. But I find for me, especially when I'm meeting a parishioner in the hospital or in a medical setting, that I am their advocate. And especially for my older patients who might not be cognitively all there, or depending on what their sort of health situation is, that I find, maybe from working in CPE in a hospital, but I find it is my job to make sure that they understand what the nurses are saying and what the doctors are saying. They get enough attention from the medical staff that they need to get. And then what I find as well is, because we get a lot of sort of different people from the outside coming into our congregation, is a lot of my job is resourcing out. People come in and say, I have this problem, where do I go? Because we're on State Street, we get a lot of homeless and vagrants, and they're coming in and saying, where do I go? And there's not a lot of places to send them. And so being able to have the list of somebody has, this problem, this is where you should send them. And we have our own list that we've put together, but half the time I feel I'm sorry, there's nothing there for you, but I'll pray for you.
That's come up time and time again.
Yeah.
The idea of a list of resources or things like that, where people can, know these are reliable places to refer people to.
Well,
And I
you
think-
know where to get started.
Yeah, I think as a good, part of being, I think as a good pastor is recognizing where my gifts end and being able to say, I can sit with you and give you pastoral care, but if you need to see a counselor, I'm not a psychiatrist or a psychologist. So I want to be able to know who I can then refer you to. And a lot of the people who I work with are low income or don't have a lot of income or might not have insurance or have specific kinds of insurance. And so who can I send you to that you're going to be able to actually see?
Yeah. So this is an interesting sort of line, an example you gave before, because I imagine there may be the perception that actually you are a counselor, or you provide that sort of role in some cases, or they're looking for some sort of guidance. So is that a fine line to walk? And how do you when you go from providing some basic spiritual guidance to you need to really speak to it?
Could I inject a point? Because I just brought my badge along with me for the sake of bringing it. But anyway, one of the things that maybe we need some more training, because initially there are so many laws that we can't do, and maybe not all clergy know what you can and can't do because we maybe not got enough training.
Yeah.
Because the laws has changed. I've been in the ministry 48 years, so I've seen a lot of changes. And it takes something to even get one of these, not just to walk in and say, I'm pastor so-and-so and so-and-so. Because of the restrictions and the hospital laws confine even the clergy in performances of what they can and can't do. It's easy to sit here and say what the problem is, but it also entails how much of training that college is willing to give all of us, because the laws do change. And I can sit here and complain all day long, but since I know some of the laws that exist, I have to be mindful not to get sued, not to even allow the hospital to get sued because of my misunderstanding. And I think that to sit here and listen is a good thing. I guess all of us may have some complaints, but the whole idea is how is college going to help us to answer some of the things that we can do within the system that's already been designed.
Yeah. So to that end, what are some of the things that you would like Cottage or the community in general to do to help alleviate some of the issues that your folks are facing?
Well, building on what Lewis is saying, I think if Cottage offered something like a kind of a four-person's clinical pastoral education, when I did my theological training back in the early 70s, we had to complete at least a quarter of what was called CPE, or clinical pastoral education. And I have to say that that was very significant in terms of teaching basic pastoral skills and what's appropriate to do in hospitals and what isn't. And you have a lot of pastors that come from, kind of storefront type churches that have never had any kind of pastoral training at all. And maybe they've taken a Bible or correspondence course or something, and so, sometimes a level of pastoral care on the clergy side is not as strong. And I think this is where, rather than just criticize it, I think could offer ways that, the pastors, what's appropriate to do when you're calling on somebody in the hospital.
There are many big traditions, ours being one of them, that have bivocational ministers. And so they're not seminary trained. And so the whole idea of knowing some of this deeper educational parts are important. And then there's been a pre-HIPAA life and a post-HIPAA life. and how we get to be intimately involved in conversations with physicians and nurses and therapists and everything else. I mean, it's really a different world. I get people to sign my own kind of HIPAA form so that I can be engaged as an advocate in what's going on.
It's funny, I was going to ask that question earlier, but since now you brought it up, what is the current, when you advocate for someone who's a patient and also a member of your congregation, what is the line there? I mean, is there ever HIPAA consent that's provided to a member of the clergy? Is it something where you always have to sort of just steer clear from that place?
Typically, it doesn't come up. And, you're in a situation where sometimes you can't even find out what's going on with the person.
Yeah.
They may not be very comatose, and, family members may not be very helpful in that way. And so you have no idea, and you can't ask because they can't tell you with HIPAA. And when I think that probably a better way of dealing with it with the hospital chaplain could be developed, because I was the one that raised this question with her about HIPAA. And, in churches you have prayer trees and things like this, and how much can you say? And I'd have to say that it didn't deal realistically with the realities of congregational life. Yes, you want to preserve the dignity and the privacy of people, but, what can you say, what can't you say? And I didn't think the briefing was overly helpful in helping us resolve something that is not always easy. And, most churches have a caring community, and the They aren't just wanting to be nibby about somebody's life,
Yeah.
they want to know, what am I praying for?
Right.
I want to give Pam Washburn, credit for.
I'm not criticizing Pam, but
Right, no, I
she did a tough job.
didn't hear his criticism, but, as the years go by, there's probably a little more clarity that she could give us. I think it's been a while since she's had a clergy convocation, where she, can lay out those ins and outs of the HIPAA rules, and, if we're wearing a hospital badge, what are our responsibilities towards HIPAA, and as opposed to, coming as just as purely as a pastor from our congregation.
Yeah.
I was going to say that a lot of it has to do with the relationship with the person and the patient, what they're wanting you to know or not know. And then once we're able to decide what that would be and how I can be helpful, then I make sure that we bring in a nurse or a social service or something and get my card on the chart to say, Mark has indicated that he gives permission for me to have awareness of the journey that they're having here in the hospital and how I can be helpful. You could be calling me. Clergy there in the hospital is very attentive, I find. But you have to get involved in that. And I get called a lot of times to come in and hear what they're being told because they don't understand what they're being told. There's no one that understands the health medical side and brings it back out into layman language for choices that are going to be considered and what they heard. I mean, I heard a person in my presence told 3 or 4 different ways what their disease was, and when I finally said, "Do you understand that you have cancer?" It was like, "What?" I mean, it was that convoluted in the conversation. So a lot of times advocacy is very important, but I believe that we all need a little extra training and resources on when to refer and who that means for what kind of a special need or economics or whatever we know. Who do we go to?
Yeah.
The next level of any health system of recognizing the importance of spiritual health for somebody is being proactive with it. So when somebody checks into the hospital, actually asking them or their family if they're not alert, who is your spiritual leader, and may we share the information with you? Would you like me to reach out to them and call them and tell them that you're here? As part of the check-in procedure.
Yeah.
Just as a point of information, one of the areas where clergy often play an advocacy role are in nursing homes. And you may have somebody who has no family and can't always speak up for themselves. And on more than one occasion, I've had to be an advocate for that person where I didn't feel that the treatment they were getting was up to proper standard.
Yeah.
And I've also had a concern from sometimes, because we do have a lot of assisted living facilities in Santa Barbara, that perhaps the hospital, not the hospital, but the nurses and the discharge planners do not really understand. This is not a medical model facility. They don't necessarily have LVNs or RNs and things like that. So people are sent back to their home, which is assisted living, with some expectation that that's not what that is all about. And I don't think there's a good educational connection on that. And we have a lot of assisted living facilities here in Santa Barbara.
I'm flipping it a little bit. I think it's a helpful conversation about what happens when you enter into a hospital. But also thinking, what is the opportunity for, and I mean this figuratively, not literally, the hospital to enter the church? And I'm not saying sort of the bringing of scales. I'm just saying sort of like...
You know how fast we got off on that
Yeah. But it is the idea of the communication of health information or certain services being held in conjunction with, a church. And I've heard of immunization programs and other things like that. I'm just curious to know whether those are the kinds of things that are happening, aren't happening, opportunities to sort of do more of that.
I would love to have you y'all come and speak after Sunday at any time on any health-related topic you would like to, and invite the whole community around me. Give it to Denise and Mark.
Yeah. I have congregants constantly who are like, can we do, a forum after church on Sunday on fill in the blank? Like, if there is a medical crisis that happens, or, dementia, for example, like coming in and talking to us about, dementia and dementia care, like, anything like that would, and I think not just coming into the congregations, I think any congregation would be like, yes, please, but also inviting the clergy into the hospital to do stuff, train us informationally about, certain health topics, not just like legal stuff, but I would love to know more about, I do my own reading, but more about, stuff like dementia, like different things. But what I find sometimes, and I find this as having been in Newtown during the shooting, is trying to work with schools too, as well as hospitals, because there's such strict security laws that when you call and you say like, hey, I would like somebody to come and talk to our congregation about X, Y, and Z, it's like you're looked at with suspicion and like, why are you wasting our time? We have other better things to do. Or, I don't want to deal with this. And so they're being sort of like someone who is like the point person for community education and for community connection, who like knows that people are going to call them to be like, how can I schedule a time and meeting for you to come and talk to my congregation, my particular community. So it's not like, you're calling and giving me more work to do, which sometimes is how it feels.
Yeah.
Is there such a person?
No,
I don't,
no.
I'm aware
I
of
just made up a job.
Careful, you're gonna get hired.
I'm aware of any faith tradition that does not have something very foundational, the sacredness of creation, starting with our own bodies. And that we are called to be stewards of that. So programs that involve eating habits from our children on, because when we start trying to have conversations with 60-year-olds about certain changes, it's harder than 6-year-olds. I think a lot of us would be happy to have blood pressure clinics and diabetic glucose checks and a variety of things available to in the congregational as a host setting, or conversations about health and wellness.
During bagels and baklava.
Bagels and baklava, how does that one work?
You've got the brandy with the doctor there. That would be something we could do.
Well, most people get their medical information via Google.
Yeah.
And so to be able to like excuse my French, but cut through the crap and the nonsense and be able to have somebody who like is an authority in the subject come and say, I'm going to talk about whatever, because even if you don't have like diabetes or cancer, you probably know someone, or you probably know a little bit about it. So, I know I would have people who would sit in on that conversation regardless of whether it applied to them, because it applies, because you're in community constantly. So I think that is such an advantage too, because now you're not dealing with like the WebMDers who think they're dying of cancer when they have a sore throat.
Yes, and then yes.
I was only going to suggest, because I know the Red Cross will come and do services for high blood pressure, counseling, talking, set up the whole time frame for anyone who wants to come talk, get some information. We do at the church, I did 1 year ago, but so I need to do it again. I've been trying to get it scheduled, but anyway, there's a lot of information that we need to get and can get, because life changes, and unless we are aware of helping our members to eat healthy, exercise, and all the other things, it takes more than just being preached to. And because of the fact that what's available, I had, I'm digressing to say this, but I had a couple of undertakers to come over.
A couple of what, sorry?
Undertakers.
Oh, yeah.
Mortuaries.
Yeah.
But I had them come over and make a presentation and leave some books. Who's in charge? And so, like I said, I want to make sure that the information is available. And because if you are upset and everybody wants to be in charge, and then if you got some outlines of who's to see, who's to call, etc., it alleviates a lot of other things that that can happen in the family trying to help themselves.
Yeah, yeah. Well, certainly if you can have a referral program for morticians, you'd like to get a little ahead of that curve, right? For them, yeah. Sorry, go ahead.
I think another open door for you would be, particularly with the boomer generation, is helping to spot when you need to begin taking more of an active role with care for parents. And a lot of times I get them because they don't know, what do I do, what are the resources, what can I do? Or you'll get people who say, well, why can't the church take care of, this person? And they realize that, most people are not skilled in knowing what to do to pick somebody up if they fall and things like that. So I think this is another area where it's an opportunity for the hospital to, have some interaction with the faith communities. And a topic that people probably get a full house.
Yeah.
Well, this is exactly what we just named our new vision to include this next year, to love, connect, care, and serve, not only within our church but the community, because that's the question. We have a lot of retired people in Montecito, and to start running monthly, but a couple times a month, different seminars. And I know we did that with, there's a group called M4, which are the 4 churches in Montecito. We get together every month, and the pastors, and we share a meal, and then we plan things. And we did that a couple years ago, and it was incredibly successful. And so, that's, and so I took your name down. I'm calling you for sure on some stuff, and I'd love to know a cottage you would call. Because I think that does get people's attention. We have a preschool, and I know for those parents, the question is, what do I do with my aging parents? And so if we offered that, I guarantee they would come. And to go out, expand beyond the borders of our church walls is what we really want to do. And we don't want to make it, we figure if we meet people's needs, then they might actually start looking and seeing who we are and what we're saying about other things. So,
Right, yeah.
I think it is important.
Yeah.